Hi, my name is Mike Rackley, and this is for my evidence-based paper, NU 403, spring 2018. Nutritional education for individuals using antipsychotic medications and antidepressant medications. Problem: individuals that have been diagnosed with psychiatric disorders have a higher rate of premature mortality related to the medical comorbidities. We're going to look a lot today at both diabetes and obesity related to these. There needs to be more nutritional education provided to the patient in relation to how they can help improve their physical health after being on their psychiatric medications. People with severe mental illness compared to the general population are at increased risk for obesity. The likelihood of being obese increases 2.8 to 4.4 fold in patients that have been diagnosed with schizophrenia. In patients that have been diagnosed with major depressive disorder or bipolar disorder, the increase is 1.2 to 1.7 fold. So pretty significant increases in these when you get diagnosed and you're taking the medications for these. So do these factors need to be looked at, especially when you're talking about the health? Yes. Obesity has caused a lot of problems, and if we're not educating our patients on these, it's just going to get worse. The prevalence of diabetes type 2 increases. Some staggering numbers here. 2 to 3 fold in patients diagnosed with schizophrenia. 1.2 to 2.6 fold in patients that have been diagnosed with major depressive disorder or bipolar disorder. Big key, a lot of these onsets were 10 to 20 years previous or earlier than the general population when the onset is. I mean, a lot of problems coming from this. Sad fact, there was a 3-fold increase in the youth that are taking antipsychotic medications. I mean, can you imagine a 3-fold increase in youth with diabetes? Just because, so there needs to be that education that's going on with our patients. Big number, 10-fold increase in patients with schizophrenia going into diabetic ketoacidosis. There needs to be a lot of education going on with this, because when you're dealing with diabetes, there needs to be a lot of education going on. And when you're increasing these statistics, these facts going on, they need to be more of an education and more monitoring going on. And our patients need to know this. Significance to nursing research. Nursing research has a very large influence on both the current and the future of nursing practice. If we see these staggering numbers going on right now, we can help learn this in the future also. We can take this knowledge and say, hey, we can go forth, say, this is what our patients need to know. Be able to, hey, give them a lot of information so they can make informed decisions about this. The diagnosis of the mental health problems and the possible consequences the medications can cause leads us into looking at ways of developing strategies to decrease the risk of morbidity and medical problems that result because of it. Significance in education. Robert Geis, I like this statement, stated, I like when patients tell me that they understand their condition and meds better, and that now they're optimistic about their health. Why are they able to make this statement? Because of nursing education. I love it when patients are able to say, hey, this is what caused and here's why it caused. That shows me, hey, we've done our job. So many times people can't, and you know a lot of times it is because the nursing staff, mental health professionals, healthcare workers all over, we're not up to date on it. Knowing what these diagnoses and medications can cause should be an eye-opener for medical professionals. We should be so willing to do all possible to give the patients everything they need to be able to make the informed decision. Significance in nursing practice. Patient education should be a very high priority in the nursing field, but often it is overlooked. Sure, the discharge education has gone over very quickly, but will our patients be able to make informed decisions regarding their health and medications because they know what could be the possible outcomes? Have we done our jobs? Especially with these being diagnosed with mental health and taking the medications. We see that need for that increased nutrition or the increased education. The purpose of this investigation was to allow medical health professionals to come to a realization that there are problems physically that can result from mental health diagnosis and the medications that are taken. We've seen obesity and diabetes, two of the big ones through this so far. The paper I chose was Interventions for Weight Gain in Adults Treated with Novel Antipsychotics by Aquila and Emanuel. In here, they used novel antipsychotic medications to determine if there was an effective weight gain. Through this, the population was actually in the facility for a year. They've been on this medications now for a year. They were all homeless. It was a controlled situation. So the diet was controlled, what they ate was controlled, when they ate was controlled, right? They were given medical psychiatric care. This comprehensive intervention strategy looked at these: the overall health, nutrition, supportive care, okay, diabetes support, nutritional education, explaining healthy eating habits. This is where that education was so important. Here was the study. I like this study so much. The beginning of the study shows us that those psychiatric medications did cause weight gain. Okay? If they did cause weight gain, what begins to happen? They need to be educated on what they can eat. Can't be eating the exact same things if the increase is going on. We've seen the 2 to 3 fold increase in the diabetes. We've seen the 4.4 possible fold increase in obesity because of these. So there needs to be that nutrition education. Over the course of the year, this last part, it was not statistically significant increased weight gain. Why? Because of that education and being controlled. Yeah, patients need to be able to understand that. We need to be able to tell them. How many of the patients or even the healthcare providers knew about the nutritional changes that have been set by the ADA? I talked to a few people at work. Absolutely none of them knew about it. This is where healthcare professionals need to be educated so that we can educate our patients. Okay? Being able to make informed decisions requires knowledge that needs to be given to the patient if they are to make the best informed decision about their nutrition in relation to their psychotropic medications. Not only do the patients need to be educated on the nutrition associated with the medications they're taking, but the healthcare workers should also have a better understanding of the nutritional problems that these patients face so that the education will be more beneficial. Thank you very much.
Amen.